Bismillahirrahmanirrahim. Today we are going to study the permanent maxillary canine. The permanent maxillary canine replaces the deciduous canine. It is third tooth which is located from the midline. The mesial contact is shared with the lateral incisor and distal contact is shared with the first premolar. So it shares the mesial contact with the lateral incisor and distal contact with this first premolar. The crown outline or crown form is pentagonal or five-sided 1, 2, 3, 4 and 5. When you see it from the labial or lingual aspect 1, 2, 3, 4, 5, five-sided. When you see it or view it from the proximal aspect, it is triangular or wedge shaped. It has a sharp cusp incisally and two biting edges. These are the biting edges and this is the sharp cusp. It has a bulky crown when you compare it with maxillary central incisor, especially labiolingually. Especially this from labiolingually, it is wider than this maxillary central incisor. When you compare it with maxillary central incisor, the crown length or incisor cervically, it is similar or same or even slightly shorter than the maxillary central incisor. Mesiodistally, this is a narrower tooth. The canine is a narrower tooth, whereas a maxillary central incisor is a wider tooth mesiodistally. The root of the maxillary canine is longer than that of maxillary central incisor. There is a greatly developed cingulum and it is much stronger than the cingulum of maxillary central incisor. Coming to the labial aspect, the labial aspect is pentagonal in shape or five-sided. It is convex in all directions, mesiodistally as well as incisor cervically. But mesiodistally the curvature is more pronounced. This is the mesial margin, this is the distal margin. The mesial margin is convex from the contact area to the cervical line. This mesial margin is convex from contact area to the cervical line, and this mesio-incisal angle is rounded. The height of contour is at the contact area, which is located at the junction of incisal and middle third. The distal outline, this is the distal outline. It is shorter than this mesial outline. and is concave between the distal contact area and the cervical line. So it is concave between the distal contact area and the cervical line. The disto-incisal angle is more rounded than the mesio-incisal angle, and the height of contour is at contact area in the middle third. This is the incisal margin or incisal outline. The tip of the cusp divides it into two components, the mesio-incisal slope and the disto-incisal slope. The mesio-incisal slope is shorter than the disto-incisal slope prior to the adhesion. This cusp tip is located in line with the center of the root. This cusp tip is located in line with the center of the root. So it is in line with the center of the root. With adhesion or use, this cusp tip moves to the distal, thus lengthening the mesio-incisal slope and shortening the disto-incisal slope. The cervical outline is evenly curved towards the root. This cervical outline is evenly curved towards the root. There is a labial ridge in the middle of this labial surface. It transcends the middle of the labial surface in an inciso-cervical direction and is more pronounced in the incisal portion. This labial ridge is due to the greater development of the middle labial lobe. On either side of the labial ridge are the two depressions, the mesiolabial developmental depression and distolabial developmental depressions. These depressions separate the three labial lobes, the mesiolabial lobe, the middle labial lobe and the distolabial lobe. There are imbrication lines which are found in the cervical third of the labial surface. The height of contour of the labial surface is located in the cervical third. Coming to the lingual aspect. The lingual aspect is also pentagonal in shape. The mesial, distal and incisal outlines are similar to the labial aspect. The cervical line curves asymmetrically toward the root apex. The cervical line curves asymmetrically toward the root apex, with slight offsetting towards the distal. You can see that it's slight offsetting towards the distal. Mesiodistally, it is narrower than the lingual surface because of convergence of mesial and distal surfaces towards the lingual. There is a bulky, normally smooth cingulum. This is the cingulum. Cingulum is a rounded eminence which encompasses the cervical third of the lingual portion of the anterior teeth. There is a lingual ridge which extends incisogingivally in the center of this area. with a shallow mesiolingual fossa and distolingual fossa. Be- Between the lingual ridge, there is mesiolingual and distolingual fossae. These are shallow fossae, and there are prominent marginal ridges, the mesial marginal ridge and the distal marginal ridge. Mesial marginal ridge is longer than the distal marginal ridge. There is a lingogingival groove which separates the cingulum from the fossa, or which separates the cingulum from the incisal half of the lingual surface. Sometimes there is a lingual pit in the center of this lingual surface. The height of contour is in the cervical third. Now coming to the mesial aspect. The mesial aspect is triangular in shape. It is convex in all directions, labilingually as well as incisal-cervically. It is wider labiolingually than the mesial surface of our incisor. This is an incisor tooth. So this canine is wider labiolingually than the labiolingual dimension of the incisor. Shape is triangular in shape, or also called wedge-shaped. This is the labial outline. This is the lingual outline. This is incisal outline, and this is cervical outline. The labial outline is convex incisor-cervically. Convex incisor-cervically with height of contour or crest of curvature in the cervical third. The lingual outline is concave in the incisal half and convex in the cingulum area. The concavity is less than on the incisor crown because of this lingual ridge. Here there is no lingual ridge, so here the concavity is more and here the concavity is less. The cervical line is evenly curved towards the incisal. This cervical line is evenly curving towards the incisal, whereas on labial aspect the cervical line curves towards the root. So this is the difference between direction of cervical lines. The incisal edge is thick. This incisal edge is thick from this aspect, and it has an outline which slopes from labial to lingual. The contact area is located at the junction of incisal and middle third. This contact area is wide in shape and longer incisogingivally than labiolingually. So it is longer incisogingivally. The height of contour is at the junction of incisal and middle thirds, same as contact area. The distal aspect is similar to the mesial aspect. It is also triangular in shape with some exceptions. The distal surface is shorter or smaller, generally smaller, with shorter labial and lingual margins. The cervical margin exhibit less curvature incisally than on the mesial. The lingual outline of the distal margin ridge is more irregular than that of the lingual outline of mesial marginal ridge. The contact area is more circular and is located in the middle third. More circular and is located in a middle third more cervically. There is a concavity present on the cervical half of the distal surface. The height of contour is associated with the contact area in the middle third. Now coming to the incisal aspect. The incisal aspect is asymmetrical diamond shaped outline. It is generally convex in its labiolingual outlines. Both labially and lingually it is convex. So it has a thicker labiolingual dimension than this maxillary central incisor. So this canine is a thicker tooth. The mesial half is thicker labiolingually than this distal half. This mesial half is a thicker than this distal half. The distal half is thinner and exhibits a slight concavity on its labial and lingual surface. The cingulum is offset towards the distal. The cingulum is offsetting distally. There is a single root. The root is single. It has the longest root of any tooth in the oral cavity. The root tapers to a sharp apex, or the apex may be slightly blunted. Root is wider labiolingually. The root is wider than mesiodistally. This labiolingual dimension of the root is wider than this mesiodistal dimension. Both labial and lingual surfaces of the root are convex, while mesial and distal surfaces of the roots are flattened. So this was all about the maxillary canine. I hope you understand the concept of maxillary canine.